the webinar will work your way through it. We've got well over 140 people now registered on this, so I think this is one of the biggest ones I've been involved in. I can also say thank you to the NHS Institute for organising this and setting it up, and also, of course, to our colleagues from the British Columbia Patient Safety and Quality Council, Christina Krause and AJ Puri, who I'll hand over to shortly. Just by way of introduction, I just wanted to say just a few words, really. Here at NHS Employers, I guess we're relatively new to social media. We've been engaged in it now for about a year, using things like LinkedIn and Facebook, as well as Twitter, through both our corporate accounts. We've got a number of individuals that use it, and we also use it on things like NHS careers. And I guess over time, I've become sort of besotted, really, with the sort of opportunity that social media presents with us, both for communicating what we do, for broadcasting and letting people know out there where our information is coming from, how we sort of engage with it. But really importantly, how we sort of engage with people and listen to them. Whenever I speak to people about things like Twitter, they always say, why would anyone be interested in what I do? And I often come back and say, actually, the big benefit in it is finding out what everybody else is up to and what they're thinking. And it's a fantastic media for that. So I'm really delighted to be chairing this session today, looking forward to colleagues from British Columbia sharing with us, and hope to follow you through the questions as we go through and the seminars. So this is one of a series of seminars. Our next one is going to be hosted by Helen Bevan. She'll chair that session on the 17th of July, also between 4 and 5. So hopefully some more of you will join then. But for now, let me just hand over to Christina Krause and AJ Puri.
We have an opportunity throughout this call to have some dialogue, not only through the chat room and through conversation, but also through Twitter. So for those of you that are on Twitter, we encourage you to share what you're learning, to ask questions, and to chat with each other on Twitter. We'd ask that you use the hashtag NHSTweets. And just having a look very quickly here, there's already a lot of chatter happening on there. So we're excited to see the conversations that happen. Before we get started, we thought we would open up actually with a poll. And so, Ruben, I would ask you to open the first poll if you could. And we'd like to ask you, how would you rate your experience with social media? And if you look on the right-hand side of your screen, you'll see the poll there. If you can select an answer and then hit the submit button, we'll leave the poll open for about the next 3 minutes to give you a chance to respond to the question, and then we'll publish the results. So I wanted to, just before we got into the topic of social media, just to give you a little bit of background about the BC Patient Safety and Quality Council. We are a provincial health quality council in Canada, and our vision is a sustainable healthcare system built on a foundation of quality, which is not unlike what I'm sure most of you are working on within the NHS. Our mission as an organization is to provide system-wide leadership through collaboration with patients, the public, and those working in the healthcare system in a relentless pursuit of quality. And so we work very much like the NHS Institute of Innovation and Improvement in terms of really wanting to support and engage and mobilize and energize people around change and improving quality of care. We have a number of strategic directions, which you'll see here on the screen, really trying to take a province-wide perspective. In Canada, healthcare is delivered at a provincial level, and so we work at a provincial level. We've been doing a lot around advancing the capability and capacity for improvement. This is around improvement skills and knowledge, but also around the area of engagement, and certainly now as we move forward around the opportunities that social media tools can provide. And this webinar is an example of doing that. We also work to help accelerate improvement through collaboratives, through other improvement activities, through networks. We have a strong belief in a transparency within the healthcare system, and then also creating value for those that we serve. And so when we started our journey, we're a fairly new organization. We've been around, we're just entering into our 4th year. And it was about a year ago where we started to really think about the opportunity that we have in terms of the new tools that are available to us around communications and engagement. And so we actually looked to the community, organizing community, to look at how they were using social media tools, and we actually expanded our team, bringing in individuals like Ajay Puri and Kevin Smith, who are with us today, to bring their level of knowledge and expertise around how we can use these tools to help support our improvement agenda. And if you actually look at some of the data that's available to us in terms of how are people using the internet, what sort of things are they doing, well, you'll see from the screen here that we have everybody using email, regardless of which generation they're a part of. It's certainly the #1 thing that people are doing on the internet. It continues to be a huge part of us, especially in health. And certainly, again, people are also looking for, searching for information. But you'll notice here across all of the groups that health information is a huge part of what people are looking for online. And then there's some variability here in terms of use of social network sites. You'll see some real differentiations between the use of social network sites between the various groups here. And I see here that Ruben has now published the results. And so you'll see even within the group here today, we have some variation in terms of how comfortable people are in terms of their use of social media. And social media is really a number of tools, and we'll get into that in just a little bit here. But really interesting to see that sort of an equal distribution across people who are really new to social media, amateurs, and those who are comfortable. And we have a few superstars on the line today as well. So if you're a superstar, we'll be looking to you to help us as we go along in this WebEx. There's a new website that I came across recently. It's the Worldwide Hospital Social Media Monitor, and the link is on the slide there if you're interested. This was actually part of a research project that was done where they're trying to track online and show who's using social media tools. And you'll see here there's some great use across England. If you want to register your site, you can. If you go to this link, they're certainly looking for more people to engage and to share that they're using social media. But more and more, we're starting to see an increasing, fairly rapid trend towards use of social media within the healthcare sector. When we were looking at our own strategy around communications and engagement, we made use of what's called the engagement pyramid. And you can see here this comes from a group called Groundwire. That within this period, there's 3 things to really note here. On the vertical side, at the very bottom, this measures the intensity of engagement. So at the very low level, when people are observing or following, they tend not to be that engaged, but they have some level of awareness. As people move up in the levels of the pyramid, they tend to get much more engaged, much more involved, and take on stronger roles. And certainly you'll also see across the bottom, in terms of the width, that generally reflects the number of people that are involved. And so in terms of social media use, what we say is if you're looking to engage people across the bottom levels of the pyramid, if you are wanting people to observe and to follow you and to be aware of what you're doing, to potentially be speaking up to support or endorse you, communications and relationships are very important, but you can really leverage those online tools to reach large numbers of people, whether it's through websites or databases, email, social networks like Twitter, LinkedIn as an example, Facebook, become all really important tools in these areas. And as you move further up within the pyramid, certainly those online networks play a very active role, but you'll start to see more and more that face-to-face communication, those more personal relationships become more critical to success. And I think one piece that we've really learned in our journey so far and that we want to emphasize for you is that social media doesn't replace that human interaction. those face-to-face opportunities are still just as important. So we're using the social media tools within British Columbia to help amplify our work and to reach larger numbers of people. We also use something called the POST method, and this is really what we use as our approach to development of social media strategy. And so we'll very quickly just walk through this for you. The first step within the POST method is to define who are your stakeholders and what sort of activities are they involved in, what sort of behaviors or mindsets are you looking to change, where are you hoping to move people from and to. In terms of these are the objectives, what is it that you would like to accomplish? And in here, you can reflect on that engagement period. The objectives, again, if reflecting on the engagement period, you can think about whether you want people to just follow you and to be aware, or if you're really wanting a higher level of engagement. In terms of the strategy, this is a plan for how relationships with your stakeholders will change. So how are you looking to, again, within that engagement period or pyramid to move towards? And then we think about what technologies can we use, whether it is social media, whether it's face-to-face engagement, what is it that makes most sense to you, and then the last being evaluation. Certainly within healthcare, we love data, and we are very deliberate in terms of using data to help support our improvement journey. And so for whatever initiative or campaign or activities that you're working within, we use this strategy to help define our work, both at a high-level organizational level and then also at individual initiative level. And you can see in terms of the technologies that are available to us, there is a huge amount of social media technology available, and often it can get quite confusing. And so you may want to be reflecting on what is it that you want to be doing, so you can look at all of the different tools available to you, whether it's publishing and whether you're blogging or sharing information, whether it's photos, which we would use Flickr for, whether it is SlideShare, which you would be sharing presentations that you've used, YouTube, videos, networking. There's a huge amount of networking sites available to us. There's LinkedIn, NetLog, MySpace, certainly LinkedIn. I think around the professional side and the healthcare side, we're seeing more and more use of LinkedIn over time. And then also localization, where people are sharing where they are. But the three largest groups or social media platforms that people use are Facebook, Twitter, and Google+. And they're engaging in more and more ways over time, whether it's through laptops, smartphones, tablets, devices. There's many, many ways that people are now connecting into the various social media tools out there. And so we're going to use another poll. And if you can look to your right again, and Ruben, I'll ask you to open the second poll. Our question here is, my organization has a clear strategy for communicating and engaging with staff and stakeholders. So if you can take a moment and respond to the poll again, we will share those results with you shortly. So we wanted to share with you today the journey that the Council has undertaken in relation to social media. And in our next webinar, in which Ajay will be taking a lead in, we'll be actually diving into the individual use of Twitter and how you can use it strategically around Twitter, focusing in there. But we wanted to share with you today our overall strategy around social media. And so within our communications and engagement strategy, we really wanted to look at what are the tools available to us to support our efforts to improve quality of care. We've also been looking a lot at social movement thinking and large-scale change theory, which I know you've been looking at within the UK as well, about how do we embed this kind of thinking into quality and how can we use social media tools to help us get there. And we know that we need to engage at a much wider scale than we have previously in the past, not only with what we call strong ties, and those are the people that we normally engage with and have very similar relationships to, but also those weak ties. And I think Twitter, for example, creates a phenomenal opportunity to create weak tie relationships, to reach those that we normally wouldn't engage with, and to build active relationships with them. So the opportunity for building a network is absolutely phenomenal through tools like Twitter. And we do this through active engagement, through storytelling, and also an active digital strategy. The Council has created our own strategy based on these three big areas. We talk about email, we talk about social media, and we also talk about engagement. Within email, we use a program called MailChimp. We, at an organizational level and at an initiative-based level, we also target people very clearly through emails and also in terms of supporting our partners. And email continues to actually be one of the biggest strategies that we use in terms of driving our work. But we're also moving more and more into social media. And as you saw from the previous slide, there's a huge amount of social media tools available to us. And so we had to make a decision based on the capacity that we have. Where did we want to focus in on? What are our priority areas? And we are looking at Twitter, YouTube, and blogging as our biggest opportunities, but also we'll be looking at LinkedIn and Facebook, SlideShare, and then always doing an ongoing monitoring process to look at what other new tools are emerging that would be useful for us. We also continue to invest very heavily around other engagement strategies, whether it's through webinars like this, but also in-person meetings and forums and opportunities to connect with people in person. Social media does not replace those person-to-person relationships. Those are absolutely continue to be critical. In terms of our email marketing, we do use a program called MailChimp. It's free software. It creates a fantastic opportunity to measure and to disseminate information. We also use targeted personal emails and also partner emails. And so in terms of newsletters, we talk about newsletters sort of in a new digital way. We know that they have to look pretty. If they don't look good, people tend not to read them. We also have a number of different databases. So we segment out our population and we'll do much more customized emails and newsletters towards them. And then we also are very deliberate in terms of how we measure that. So we know that of the majority of the emails that you send out, 98% of people will receive them. 2% will either bounce back. Either you'll be aware of them or you won't. Of the people who receive your emails, between 18 and 26% will open them. So not a large number, about a quarter actually open and will look at your email. 2 to 5% of those that open them will actually click on a link that is within it, and then 1 to 3% will take action. So how many people do you think are actually taking the email communications that you're sending out? It really becomes quite important to track. And we can do that, and that's why MailChimp has become such a powerful tool for us. Here's an example of a newsletter that we sent out following our quality forum. And what you can see here is that we are actually able to measure where people are clicking and how many are clicking. And so in this example, we put our presentations online, and 52% of the individuals in our database actually clicked on that link. And then we were able to see over time what interests people, what are the areas that people find engaging. And so we can start to customize our communications moving forward much more clearly by using tools such as MailChimp. Before we move on, I just want to look at, I think our polls have been published. And so again, in terms of organizations, we have probably the majority of individuals who are feeling that there isn't much of a strategy, or it's pretty good, but certainly on either end. I'm glad to see that there are very few, seven individuals who've mentioned that they don't have any strategy, and some who have a very clear strategy as well. So lots of opportunities for improvement there. We are very deliberate around the use of telling stories. We actively seek out stories not only from our own staff and our partners, but we also actively in our newsletters will ask people, had to create a two-way dialogue, ask questions, ask them to share stories with us. Documentation, whether it's through blog or video, photos, or audio, become very important. And then we share these through the various social media platforms, our website, emails, and with our partners. And those stories are a huge opportunity for engagement, an opportunity for us to not only celebrate the success of what is happening, but engage people in conversation. And those opportunities for engagement and to have conversation are what bring people in. So we wanted to just give you a concrete example of how we're using all of these various social media opportunities. And we had in March of this year a quality forum. It's an annual conference that we host here in British Columbia. And we used 7 different tools to help us to document, to share, and to engage others around the quality forum. One of the probably, I think, for me, one of the most interesting tools that we used was actually something called SlideShare. We uploaded 135 slides, which is 135 presentations, to from the forum itself. And what you'll see here is that we have a fantastic opportunity to display all of the presentations. It's very easy to follow. People can view them within the website, or they can also download them. So it's a great way to increase access to information. And one of the things that we know is that when people have access to knowledge and information, that's their source of ideas. So taking the deliberate steps to share and to make it easy to share information, especially for those who were unable to attend, becomes very important. But what you'll see here is that we're able to document and track the number of views for each presentation. And so we can also, in terms of planning for next year, start to get a clearer sense of what is it that interests people, what were the most popular presentations, what were the areas of information that people were most interested in. And it also provides an opportunity for you to track statistics. And we are now at just over 14,000 views of the presentations from our quality forum. And for us in Canada, that's a pretty big number, so we're very excited about that. And then we can also measure which presentations were the most popular in terms of views. When did people view them? So we were able to say right after our event, that's when our newsletter went out. That is when we had a huge spike in traffic. But there's been ongoing traffic since then, right up until July 5th when we pulled this report. It also helps us determine where is it that people are finding these, whether it's through a direct search, SlideShare, Facebook, etc. And so those statistics become very important for you to do future planning and also to understand where it is best to reach people and to pull them in. We've been using blogging as an example to share information and knowledge. And then also in terms of how we present information, we're using multiple tools as well. So we're using graphic illustration, we're using video, and we're using something also called Storify, which we'll present to you in just a moment. This is Flickr. Flickr essentially is a fantastic tool for sharing photos from various events. We've learned that people love to see themselves and to see what actually happened. And Flickr is a very nice way to organize pictures that people are able to sort through either during an event or a meeting. And so following big events, we'll upload pictures to Flickr, and it becomes, again, a very powerful tool. We're also using video very deliberately and strategically to promote new initiatives at the very beginning of our work, to use it for storytelling, documentation, education, a variety of tools. If you can create a 2 to 3 minute tool, it becomes, or video, it becomes a very, very powerful tool to share that people can use in presentations or just information. And so we've created our own YouTube channel. Anybody can create a YouTube channel. It also, again, enables us to track how many views, so what are the most popular videos, and also the number of people who are joining. And so this first video, this is the future of surgery in BC, has had almost 1,000 views. This essentially is a 2-minute video that outlines what we're planning to do. We don't actually have any results yet. It's a very, it was a video that we created so that people out on their sites could use it to engage others in this change. We have 90% of the operating room theaters in British Columbia who are part of this surgical initiative in BC, and actually the American College of Surgeons took this video and posted it on their website, and so we were able to have the opportunity to promote the work that we're doing in British Columbia nationally as well within the United States. And so again, the opportunity through YouTube and having a YouTube channel becomes a fantastic way to share information and to engage others and to create a tool for them, those that you're engaging with, something that they can take and use when they're also reaching out. Twitter, and I know that's the one that people were probably most interested in, is something that we've been actively using as an organization for just about a year now. We see it as a unique opportunity to engage with colleagues, both those strong tie relationships and also those weak tie relationships. So broadening our network, engaging not only with individuals but also with organizations that we normally wouldn't have the opportunities to engage with. We use it to disseminate calls to action to large audiences, to create awareness of new issues, to build and strengthen communities, and also to promote learning from events. And I think the example of the conversation that's happening on Twitter right now with the NHS Tweets hashtag is a great opportunity for those that aren't able to join us today to follow along in Twitter to see what's happening and what's being discussed. Within the Council, we use our organizational Twitter account as an opportunity for us to become a trusted voice around health quality. We also use it, though, to support the work of our partners, and we can do that very effectively from retweeting, sharing information of our partners. And so I think for me, one of the most amazing aspects of Twitter has been that opportunity to support others and to use our networks and to share with each other to promote what each other are doing. It becomes a very, very powerful tool. We also have been, within our staff, supporting our staff to actively get on Twitter, and also those within the health community trying through beginners workshops on Twitter to grow the involvement, because we know the more people we can move online to have online conversations, that grows that network. I would say right now there's a very small proportion of people who work on health who are on Twitter, so it's just going to be one of those moments and opportunities that I think will just grow and explode over time. And so our strategy is we have a couple of layers within our organization that we use to support our work. We have our overall Twitter account, which is at BCPSQC. That's our organizational Twitter account. It tends to be an account that we use to disseminate information, to distribute call to actions, to make announcements. But we also have Twitter accounts for various initiatives. So again, it allows for that customization and segmentation of the audience who is interested in particular areas. So our SQUAN account is actually our surgical account. It represents our Surgical Quality Action Network. We also have a BC Sepsis Network and then our Quality Forum. And as more initiatives come on board, we'll create those initiative-specific Twitter accounts. We then have our staff, and as much as our staff, we've listed a few examples here, we encourage them to also get on Twitter. And what we have then happening is an interplay between our staff-based Twitter accounts, our initiative accounts, and organizationally. And we encourage more conversational type discussion to happen amongst our staff, and then we use our organizational Twitter account to amplify that through retweeting what our staff are saying. And so we use them as that interplay opportunity. And what happens is by doing that, your reach, your potential reach becomes that much greater by having the interplay happening between those three various levels. And so as a council, we've been very purposeful and strategic in terms of who we follow. So we follow those that align with the work that we're doing, both based upon our mission, based upon our values. And by following people, it helps to build your own following. And so the general principle that we find is that 15 to 25% of those that you follow will follow you back. And so initially, as you're getting started with Twitter, you want to follow a large number of people, and that helps create your initial base to get going. But we also follow organizations and individuals that align with our work, because that's how we learn, and that's how we create opportunities to retweet, to share what others are saying, and create that opportunity for those supportive partnerships. We actively engage with those who interact with us, and we also actively reach out with others. We do that through retweeting our partners, thanking those who retweet our content, and then also through the Follow Friday. And for those of you that are new to Twitter, there's a sort of a bit of a trend that happens on Fridays where people with Twitter accounts will send out suggestions of who you should follow. It typically happens on Friday with the hashtag Follow Friday. We also try to generate active dialogue on relevant topics that are timely. And we know that the way that you disseminate content has to be fresh, it has to be engaging. So we'll live tweet from events, an example being today, our quality forum. At our quality forum, we also had what was called a Twitter wall. And essentially, that's broadcasting on a screen within the event what's happening on Twitter around a particular hashtag. So if we were in a room today, we would create a screen and we would have the hashtag NHS tweets, the Twitter feed being posted on the wall. And what that does is it enables those that aren't on Twitter to actually see the conversation that's happening, and it becomes a great way for people to pull off and see the dialogue that's happening online outside of the formal conversations within the room. We also know that keeping your tweets short and witty is important. Also short because you want to leave space for people to comment and retweet. So if you use up all of your 140 characters in your initial tweet, it makes it more difficult for people to retweet what you said, because then they've run out of space themselves. We also provide links to council and partner events and documents and interesting information. So in terms of the, we wanted to give you a snapshot of the organizational approach to Twitter. And then at our next webinar, Ajay will spend a lot of time and walk you through the individual approach to Twitter. How do you actually become an effective tweeter? What are the strategies and techniques that you can use? So we'll be focusing that on the July 17th webinar. But we wanted to show you an example of what happened a few weeks ago in terms of the interplay that we have between our staff accounts, our initiative-based accounts, and also organizationally, and the potential reach that we have through Twitter. So we were at our BC Sepsis Network meeting, so I sent out a tweet saying, excited for the first at BC Sepsis Network meeting today, 57 BC hospitals working to improve sepsis care and planning for World Sepsis Day. And World Sepsis Day is happening on September 13th. It's the first, and it's a worldwide movement around improving sepsis care that's happening. So I sent that tweet out, and very quickly I actually got a response from Ross Gray, who's from Scotland. And Ross said, hey, we're planning in Scotland too. We must compare notes and results. What then happened was our network Twitter account replied and said, yes, we should. That would be great. And this all happened within about 10 minutes. The neat thing is we were able to tell the people who were meeting in the room that we were having a conversation with folks in Scotland for an opportunity to share learning. And we know that when people feel part of and see a relationship to a much broader movement, that's very engaging and very exciting in that opportunity. What then happened is our council account chimed in and said global learning. And what's very interesting then is each of the following groups between my account as an individual, our initiative account, and then organizationally now had awareness of there was global work happening around sepsis. And so I wrote back and said, that sounds great. I was going to send you a note. Let's set up a time to connect. And then we had Jason Leach chime in and say, a match made in improvement heaven. And this all happened, I'd say, within about 10 or 15 minutes. And so we have a call that's been set up with Scotland. We now have calls set up with Australia, Wales, all of us now working together and sharing and learning about what we're doing around sepsis. And that opportunity, I don't think, would have happened without Twitter, this opportunity to share and learn from others. And we know that when we have those opportunities, it helps accelerate our work and help us to achieve our goals faster. So this is just an example where we're able to increase the exposure through having those various Twitter accounts, and so at each of those levels. So it becomes a very strategic approach in terms of retweeting and creating those opportunities between them. The reach becomes much greater. We actually also track 7 key indicators, key performance indicators that tell us how we're doing. So we track the number of followers we have. We track what's called a clout score, and Ajay will spend a bit more time on that, but it basically measures how influential and how engaging you are within Twitter. The number of clicks that we get on various tweets that we send out, the number of retweets that we have, the number of replies and mentions, the number of lists that the council is a member of, and then we're also able to track our top tweets. So what kind of content are people most interested in? And so we get these fantastic reports. We use something called HootSuite. So if you go to HootSuite.com, it's a platform you can use to track your Twitter account, and it creates some fantastic reports back that tell you where people are engaging from. And so you'll see the majority of our audience is from Canada, but then our second is the United Kingdom. So we've built some really strong relationships with folks within the UK. We also have the United States, Australia, New Zealand, Ireland, Kuwait. So we're able to see where is it that people are coming from. And it also tells us where are they connecting from. And so you'll see here HootSuite, Twitter, Facebook, LinkedIn, are people connecting in directly. And then you can also track your statistics over time in terms of levels of activity. And you'll notice here we had a spike, and this was actually a call for presentations around a social media event that we were hosting. We also can track which tweets were the most popular, and so you'll see here we sent out a call for abstracts for our social media camp. We had 64 clicks. What does Helen Pevin think is the health and social challenge of the 21st century was also very popular. And so over time, you can actually track in terms of who your stakeholder group and who your audience is, what is it that they're most interested in, and what is it that they find most engaging. Here's also an example. When you have events, you can track the level of reach and exposure from a particular event. So we had a one-day social media camp in March, and we were able to reach just over 100,000 accounts, Twitter accounts, through a one-day event in terms of the conversation that was happening. We also trended in Canada, and trending basically is tells you when something becomes so popular enough, or the number of people who are tweeting around a particular hashtag, if it becomes very popular, then you become something that's called trending, so you're able to track that as well. So we had, again, in terms of exposure, we had over 1 million impressions, and we're able to see the activity. This is the day that the event was actually held. There was over 1,200 tweets that used the social media camp hashtag from 172 different accounts. And then we can see here what were the most retweeted tweets. So what were people most interested in? And then who were the top contributors? So again, if we look here, for us to reach out and to engage with these individuals becomes a great opportunity around that. We also wanted to share with you something, a platform called Storify. And Storify basically is a fantastic program that helps you to leverage all of the social networks out there to build social stories. And so it pulls data from various social media networks, whether it's Twitter, Facebook, YouTube, Flickr, Instagram, all sorts. And it creates an opportunity for you to make sense of what you've pulled together. And you can do it around one of these or several of them. And so I wanted to share with an example with you where we use Storify to highlight the conversation that happened at one of our Health Talks events, and Helen was there presenting around Pecha Kucha talk around dementia. And so you'll see here, and we've posted this Storify on our website as a way of documenting what the conversation and preserving the conversation that happened on Twitter to share with others. We also are using a lot of graphic recording now as a way to create a picture of the story of what was shared. And we've also posted this on our website as well. So there's some fantastic tools out there now that you can use to create opportunities to capture stories. And Storify becomes a fantastic way of doing that. In terms of the reflections that we've had so far, I think one of the biggest learnings that we've had is in terms of capacity. There's so much out there, so much opportunity out there, that it becomes very, very important to decide and to make tough decisions around how, which social media tools you're going to leverage. And so you'll have noticed that we've selected it, narrowed it down to a couple because the deliberate effort that happens around these tools is quite great, and so you need to be always making sure that you have the capacity to achieve it. If you're going to invest in one of these areas, then you need to actually support that. The other piece that I know becomes, even for myself personally, around the use of Twitter, I avoided Twitter for quite a long time because I thought one more place to go, one more source of information that I have to look at each day to sort and to manage can become very difficult. And so there's a lot of different ways that you can do. You can use, one of the nice things about HootSuite is that it helps you to organize all of the information that you have. It helps you can set up feeds around particular streams of information, whether it's a hashtag or an individual, and that becomes a great way to manage that information. So you really narrow down your focus at what you're looking at. I also tend to check in maybe twice a day, in the morning and the afternoon on Twitter. I don't have it open all day long. It becomes, I think another distraction similar to email. So setting up that focus time to connect in a regular work day. If you're at an event, you maybe want to be connected more often and sharing and learning if you want to live tweet an event. But I think the point is, it's just like email. It's just like meetings. It's one of those things that you need to figure out how you're going to fit it in your day and then be very deliberate on it so that it doesn't become yet another source of distraction. I know that there's been a lot of questions around people sharing information. I see a question from Louise in the question and answer about how do you manage the risk when people may post inappropriate tweets or breach confidentiality. And certainly within our organization, we had a lot of conversations about this very topic with the concern that, what is the line between professional and personal use? We are a government organization, and so we have to make sure that we follow the same level of communication standards that occur for any of our communications. And so the policies and guidance that we have around that, we set out a clear social media policy. Our provincial government also has a clear social media policy as well. But one of the things that we learned, we do have a few people in our team who are involved in political parties in their personal lives, and we certainly didn't want the fact that they worked for a government organization to get in that way. And so we have several of our staff who have personal accounts and also professional Twitter accounts. So the concept of having multiple Twitter accounts is actually more common than I had realized. And it also creates that separation for individuals who need to. We certainly do encourage with Twitter, though, that you still do share personal pieces about yourself through your professional Twitter account. So it's about being that authentic leader and showing people who you are. But if there are components of people's personal lives that they need to keep separate from their work, that's how we've separated it. We also have policies that guide sharing confidentiality, and so the same principles apply to Twitter as they do to email, as they do to any form of communication. And we certainly found that people within our organizations maintain that level of professionality within their work, and it actually hasn't been an issue. You are able to remove tweets if necessary, but it certainly, I think, hasn't been that big of an issue for us. But having a clear policy and guidelines becomes critical, and certainly we'd be pleased to share a copy of our policy with you. But I think probably the biggest reflection is the untapped potential of social media. It certainly has changed the world within which I've worked. The reach and the conversations and the networks that we now have just grown exponentially. The learning through being able to connect with people around the world in real time has without a doubt accelerated the work that we've done within BC, and also I think created that sense of connectedness that we haven't had in the past. It's about being deliberate with the use of social media, so looking at offline opportunities for connection and engagement, but also to the online opportunities as well. And I think when we think about social movement thinking and opportunities, you know, when people feel isolated and not connected, it can often get in the way of creating energy for change. And so when people have the opportunity, in particular through Twitter, but also through being able to see and learn and hear what happened at various events, whether you're posting photos through Flickr or using YouTube video or using graphic recordings to capture that, it creates a greater sense of connection and engagement, which is very exciting. And we know the opportunities to have conversation. I think there's been a very fast and furious conversation happening with NHS tweets today, but we're very interested in creating a global conversation around improving quality of care. And so we're having our first ever quality chat. We'll host it on the third Wednesday of each month at 5 p.m. UK time, and our first one is on August 22nd. I also know that there's a NHS Change chat that's going to happen, I think, every second Wednesday. So stay tuned for that. If you search the hashtag NHS Change, you'll see the information on that one way as well. There's online journal clubs where people connect. This is becoming more and more popular, and so we'd encourage you to mark your calendars and join us then. And so we'd actually like your help. And so we thought before our next session on July 17th, we have a bit of homework for you. We would encourage you to download our Twitter for Healthcare Professionals guide. This is sort of a getting started kit around Twitter. You can find it on our website. It's also been tweeted out, I think, quite a bit as well. If you, the link, you can find it there. We'd be very interested in your topic ideas for Quality Chat. We will have a guest host for each one, and so if you're interested in hosting and facilitating the conversation on Twitter, we'd love to hear from you. And we'd like you to tweet your favorite picture or toolkit related to improving quality and include the NHS Tweets hashtag, because we'd like to use some of these examples in our July 17th presentation. And so I think I'll close there. I think we have a bit of time for questions. Dean, can I throw it back to you?
Well, thanks very much, Christina. That was great. Really enjoyed the way that you walked us through that so eloquently. Lots of tweeting going on the hashtag NHS Tweets. People sort of enjoying that and sharing things around. Some questions have been coming through as we've been online, and I know some of those have been responded to. Just one or two things that I noticed that were coming up that we'll come back to you on. A few people have asked for copies of the slides, so I'm sure we can get those to you. If you drop us a question with your email address, we'll send that out to you. There was a number of questions that came up about firewall issues and people being blocked with access to things like Twitter and Facebook because of firewall issues. And I know Helen has said that she's going to tweet out a case study on that a bit later. We as an organisation are just about to publish something next week or so, which is for those organisations that want to be permissive, how can they sort of encourage staff to be using Twitter and other forms of social media as a sort of learning and a listening opportunity. And I noticed that Bob Kershaw at the Cabinet Office has said to all the civil service departments that they need to start taking those firewalls down. So there does seem to be things happening on there. But if people put some questions through, we'll try and throw those back. We've got about 10 minutes or so with Christina. Christina, one of the things that came up, I wonder if you could just come back on. People were asking about, I guess, policies on things like taking down tweets and sort of managing that side. You did touch on that a little bit, but I wonder if you could just expand a little bit there.
Yeah, basically we have, in terms of our taking down tweets, I think we've only taken down one from an organizational account when we first started, and it was related to a more of a political post about our government. So in terms of monitoring our content, I think it's about really having clarity within your team about what's appropriate content to post and what's inappropriate, and certainly our guidelines that we have within our organization outline what is appropriate and what is inappropriate. But I think, again, it's about setting those expectations. It has not been an issue for us in terms of pulling down tweets. If we do have questions within our team about which they should be posting or not, or when they're unsure, they'll often just send an email saying, I was planning to send this tweet out. Is this okay, if there's ever that question? So we encourage that within our team. But in terms of the specifics, in terms of how you remove a tweet, Ajay could probably cover that on the 17th. But it actually hasn't been an issue. And I think, again, one of the things that we are really learning about is, again, related to that transparency. And I think for us as an organization, in terms of being transparent about what it is that we're working on, what is it that we're up to as an organization, we're able to share much more readily about what we're doing when we have planning meetings, what's up and coming, and it's created that opportunity. So I think the only issues that we tend to have as a government organization is when it relates to some of that political content, and the guidance within our guidelines has been clear on that. But Ajay, I don't know if you want to comment on that as well.
AJ?
Hi, sorry, I just had my microphone muted. No, I think that was a great answer around how we look at it, and I think the key is transparency, and we're human, and we make the same mistakes on email where we might attach a file, but sometimes we forget, and so we send the file the second time. So I think with these social media outlets is just to be human.
That's great. Thank you both. The other one, I saw one or two questions that came up as well, was just some questions about unpacking really some of the value of the analytics, like HootSuite and the way that you analyze retweets. You put some stuff up there about slides and reach and things like that. So I wonder if you could just say a little bit more about some of the value that you get from that.
Ajay, I'm going to turn that to you.
Yeah, no, that, am I unmuted? Yes. That's a brilliant question. I think we do improvement work in healthcare, so why can't we use the same statistics when we use these communication channels? And I think that just helps us drive it. And Christina mentioned it. When we look at the email analytics, so when we use a program like MailChimp, it's just one of the tools out there. It helps us drive what kind of content people are really looking for. And the beauty of this is it's also real time. So with Twitter, I'm just about to post the tweet reach of what's happening on the line right now. But it's great because you get the data right in your fingertips, and then you can really manage it. And I think having that data at your fingertips helps you really make those improvement works, I mean, in a nutshell. Christina, anything to add on that?
Yeah, I think just the key is, again, to create the time and space to do that. So I think the biggest learning for me, as it is with anything, any work that we do, is you have to be very deliberate in your strategy. You can go online and you can have chatter and things happening, but unless you're looking at what is most engaging, what are people responding to, who's responding. So one of the things that MailChimp enables you to track, as an example, is who is it that is opening your email, and how many people have they forwarded it to. So you can track how many forwards. So if an individual forwards it to their entire network with an email, we know that. And so we've been able to see one person, for example, one of our emails, I think they forwarded it to over 250 people. And so we were able to reach out to them and to say, wow, you know, what was it about our content that you found really interesting? And to create a relationship with that individual, because you start to learn who's really passionate about it. And the same happens in Twitter. We're able to see who's very active, which tweets are people interested in. So it helps us to continuously look at what's engaging and to customize what it is that we're sharing and how we're sharing it, and using that continual learning. So I think in terms of Twitter, in terms of the potential reach, it's something that we're still learning. And I think the issue in healthcare right now is everybody is still on email. That is still, without a doubt, the #1 place to reach people within the healthcare system, because everybody is on email. What we're trying to do now is, with the potential that we see around Twitter and the fact that it's public, and so people that you wouldn't, in email you have to know that they exist and you have to have their email address. But in Twitter, anybody can search any term. They can search the term quality, they can search the term healthcare, and jump into a conversation. So it's much more open and much more transparent. Our goal right now is to actually, how do we support people and build the kind of capability around Twitter and other online tools to move people online within the healthcare system, because we think the potential there for shared learning and rapid learning is much greater, but we need to get people onto that system. They're not there yet in the numbers that they are in email.
And that's great. And with 3 minutes to go, that was a fantastic way to end the session. There was one final question posted, which I think actually is pitched perfectly for next week. So Mark Leach has just posted a question: is there any evidence to social media improving health outcomes? So maybe Christina and AJ and Helen, that's something you can pick up and start with next week. Mark, if you want some information, we did some stuff around NHS Flu Fighter, which improved the numbers. I guess that's more quantitative than qualitative, but happy to share that with you if you want to drop me an email. We'll get that in touch with you. Just a reminder, everyone, from Christina and AJ, there was some homework there. There was a suggestion, if you're joining the chat next week, then to download that Twitter for Healthcare Professionals guide that you can get. Something else for your diary, there was the global conversation about improvement. So August the 22nd, that sounds like a fantastic opportunity. And I know there'll be loads of people passionate about that. And again, next week we can post some more details on around that. Christina and Paul, AJ, sorry, let me just thank you both for that, keeping us to time. Fantastic. The conversation will no doubt continue on #NHS tweets, and we've still got well over 150 people that have stayed with us, 180 people throughout. A really great opportunity to share something around social media, and look forward to joining you all next week, the 17th of July, 4 to 5, where Helen Bevan from the NHS Institute of Improvement will be chairing a webinar that's entitled "How British Columbia Patient Safety and Quality Council have used Twitter to revolutionize engagement and to improve care." Now, if only people could stop you tripping over your tongue on Twitter. But thanks, everyone.